You can call Barbara Findley a lot of things.
But my name is Wayla B.
Mom, educator, friend.
Short for abuela in Spanish, which is grandmother.
But you won't find anyone calling her scared.
And I fear nothing. Fear nothing. And because I have these 2 grandchildren.
Most women in her shoes probably would be afraid, knowing they have an incurable brain tumor.
I had absolutely no knowledge there was something wrong with my health. No symptoms at all.
Barbara first found out about the tumor in late 2013.
I had a major seizure. I remember none of it. I woke up, I was in Norton Hospital, and they started asking me questions like, who's the president? I had no idea.
Told she had 3 months to live, Barbara's options included chemotherapy and radiation.
My one son, who's the physician, he, Mom, you're going to do it all.
But both treatments became intolerable for her.
And you just plug that in.
Then her son stumbled across a unique clinical trial for a new device called Novo TTF.
Right up, you let go.
It has nothing to do with drugs getting through a vein. It's not radiation. It's just low-dose alternating electromagnetic fields, which really have no impact on the patient. And there is some skin irritation in the scalp, but that's really about it.
They're called arrays. And what they are is they're transducers. They're about the size of a penny, attached to a wire, and they attach all to each other in the back. And they're plaited, as you can see. And then they're hooked up to the Novo device.
And you apply these alternating electromagnetic fields, you mess up the division of the cancer cells, and the cancer cells actually die.
Dr. Renato LaRocca with Norton Healthcare says with this form of treatment, patients carry around the device and do everything from home. It's an alternative to medications and other treatments. For many patients like Barbara, it's the last hope.
You can only kick the can as far as you can keep kicking it, get in remission, but glioblastoma doesn't have a cure.
And still kicking she is. Barbara says she thinks the device is doing its job. She won't know for sure until the follow-up MRI. Dr. LaRocca says he hopes to introduce more patients to this treatment in the future.
In the lingo of high-grade brain tumors is a big deal, using the Novo TTF device versus just standard of care.